Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help walk you through the ABCDE Assessment. What is an ABCDE Assessment? The Airway, Breathing, Circulation, Disability and Exposure, or ABCDE Assessment, is a standard resuscitation examination. The purpose of this assessment is to examine patients who have been rushed into the resuscitation room due to a life-threatening illness or injury. It is a systematic method of addressing life-threatening problems to stabilise patients and buy doctors enough time to treat patients they can survive. The assessment is divided into the following. The first being airway. Conductors of the assessment will check if there is anything obstructing the patient's airways, like foreign bodies and swollen tissues. If there are obstructions, the medical team must clear them to prevent brain damage, cardiac arrest, and even death. Breathing. After confirming that the airway is not obstructed, the medical team will check the patient's breathing by gauging their respiratory rate, if they have any chest deformities, and their oxygen status. The medical team may provide assisted ventilation and supplementary oxygen. Circulation. For this part of the assessment, the medical team will gauge the patient's heart rate, blood circulation, and blood pressure. Disability. This stage involves assessing the patient for any neurological damage by examining their motor responses, pupil reactions, and the level of their consciousness. Exposure. The final part of this assessment will have the team expose the patient, remove their clothes, while prioritising the dignity and the maintenance of their body heat. This is so the medical team can check for bruises, rashes, bleeding, etc. The team will also check the patient's temperature. All of these will be done with utmost urgency to improve patient outcomes and give them a good chance of survival. While the ABCDE assessment is commonly used by any healthcare professional, it is recommended for anyone. Here's how to use an ABCDE assessment. The first step is to fill in the patient information at the top. You'll then need to complete each section of the ABCDE assessment as described, making sure to include notes to improve for next time. Finally, input sufficient information under each section. To view a sample assessment of the ABCDE assessment, feel free to visit carepatron.com where you can download and access the sheet for free. You can also access the assessment through our platform. Simply filter by community and assessment or type in the keywords ABCDE to find the note. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos.